Today I want to have a short talk about the 6 underlying causes that lead to every degenerative disease. And if you develop one of them, it automatically has an impact on the other 5. So it is not that you have one in isolation and the rest will be isolated from it. It is not like that at all. The first one has to do with a pH imbalance. That actually means the acid and alkaline imbalance. And it is not about getting yourself alkaline or saying, well, I need to do it in whatever way. It is about creating imbalance. How do you know that you have an acid and alkaline imbalance? Well, it predisposes you to all degenerative diseases. And one of the things what you also can notice, there are of course many more indicators, but it opens you up to all kinds of bacterial infections. The second one is anaerobic tendency. And the anaerobic tendency means there is a reduction in oxygen supply. And one of the symptoms could be basically yeast infections. And there is of course more to that, but I keep it short and sweet today. Then the next one is free calcium excess. Now, how would you know if you have that? Well, if you go to the dentist and you would have a lot of plaque in your mouth, that is free calcium excess. Arthritis, anything that ends on itis, is also a result of free calcium excess. High blood pressure is another symptom. Now, when you have free calcium excess, you need to realize that this leads and drives actually all in chronic inflammatory processes. Then the next one is the chronic inflammation. Now, such as basically fibromyalgia, that is also part of a chronic inflammation. Cancer is a chronic inflammation. Now, there are some other symptoms through which you would know if there is an issue with chronic inflammation. Food sensitivities or multiple chemical sensitivities is also connected with it. Then the next one is connective tissue breakdown. Some of the symptoms are, say, if you would have bleeding gums. Bleeding gums is a result of connective tissue breakdown. Varicose veins is another symptom, and of course there are many more, but I just give you a few indicators. A weak back spine is a result of connective tissue breakdown. And then cancer, of course, is also a result of connective tissue breakdown. Then the last one is oxidative stress. Some symptoms could be Alzheimer's disease, Parkinson's disease, age spots, poor concentration, and chronic fatigue. So as you can see, there is quite a bit to it, and that is it for today.